Welcome to our next lesson, and this time we will be talking about vitamins. Vitamins are coenzymes, meaning they help in the proper function of the enzymes. And vitamins are also organic compounds. They are coming from the dietary sources, while vitamins are also needed in our body in small amounts, that is from a microgram to a milligram per day. And vitamins are very essential for the proper body function. And vitamins can also come in either synthetic or natural source. So vitamins can be classified by the two types of vitamin classification. The first one is lipid or fat soluble, and for lipids, these are vitamins A, D, E, and vitamin K. And the other type of vitamin classification is a water or the water soluble vitamins, and these are vitamin C and the vitamin B complex. For vitamin B complex, these are the vitamins B1, B3, B5, B7, B12, vitamins B2, B4, B6, and B9. So we are going to examine the differences between a fat-soluble vitamin from a water-soluble vitamin. And we have here the comparison between the water and the fat-soluble vitamins. So first, we'll be looking at the absorption characteristic of the two vitamins. For the water-soluble, the absorption of the water-soluble vitamin will be directly absorbed into the bloodstream, while the fat-soluble will first enter into the lymph system. In terms of transport, the water-soluble doesn't need any transport protein, while the fat-soluble requires a carrier protein. In terms of storage, the water-soluble will be already in the water-filled parts of the body, while the fat-soluble will be found in the cells associated with fats. For the excretion, the water-soluble can be excreted by means of the kidneys. That is why they are found usually the excess of these water-soluble vitamins can be found in the urine when urine is examined, while in the fat-soluble vitamins they tend to remain in the fat storage site in the body. In terms of toxicity, the water-soluble vitamins will not likely reach toxic level, while fat-soluble vitamins will really reach those toxic level, especially if those fat-soluble vitamins will be consumed from supplements. In terms of dosage, the water-soluble vitamins will be required in the body in frequent amount of doses, while since of the toxicity issue, fat-soluble vitamins can only be given in periodic doses. In terms of the relationship to the enzyme function, water-soluble vitamins will function as a coenzyme. However, fat-soluble vitamins do not function as a coenzyme. So we will now be describing the different sources, the different functions, the deficiency and the hypervitaminosis of these water-soluble vitamins. Vitamin C, also known as ascorbic acid. The sources for ascorbic acid are citrus fruits, strawberries, kiwi, broccoli, tomatoes, and potatoes. The function of ascorbic acid to our body is for the healing of our wounds, maintaining a healthy bones, teeth, and a healthy blood vessels. For the fighting of infection, ascorbic acid is also best known for this. For the deficiency of ascorbic acid, the symptoms are fatigue, weakness, scurvy bruising, the bleeding of gums, joint pains, and iron deficiency, also known as anemia. For the toxicity of ascorbic acid, that includes urine acidity, nausea, diarrhea, and promotion of overload of iron to patients who are suffering from hemochromatosis or iron toxicity. So these are the illustrations of a person who is suffering from hemochromatosis. For example, this is the hand condition of a person having hemochromatosis, while here is a liver comparison of a person having a healthy liver from a person suffering from a liver with hemochromatosis. Vitamin B1, also known as thiamine. The sources for vitamin B1 or thiamine are the following: whole grain, cereal, meat, spinach, eggs, and milk. The function of thiamine to our body includes the release of energy from carbs and fats during metabolism, and the promotion of a healthy nervous system. However, for a person who is lacking vitamin B1 or a deficiency of thiamine will suffer from beriberi, and there are two types of beriberi. One is the wet type of beriberi and the other one is a dry beriberi. Beriberi is actually a health condition wherein the pyruvic acid builds up that will cause muscle wasting and sometimes will lead to death. Another symptoms of a deficiency of thiamine will be the retardation of growth and also fatigue and irritability. However, for an overdose of thiamine, that will include a blockage of the nerve transmission, restlessness of a person, convolution, and labored respiration, respiratory paralysis, and cardiac failure. Vitamin B2, also known as riboflavin, sources are liver, pork and beef, milk, dairy products, fish, eggs, cocoa, nuts, yeast, and cereals. The function of riboflavin to our body are the following. It serves as an antioxidant. This is the reduction reaction of those radicals. And this is the reason why riboflavin is sometimes called the beauty vitamin. Riboflavin also helps in the growth, nerve function, digestion. It also works with protein for maintenance of our body, energy metabolism. And so the deficiency of riboflavin includes dermatitis, ichthyosis, and glossitis. So this one is glossitis, the other one is ichthyosis. And for the overconsumption of riboflavin is also known as hypervitaminosis B2. That includes itching, numbness, burning or pricking sensation, and sensitivity to light. For vitamin B3, also known as niacin, the sources for niacin is from mushroom, milk, grain, poultry, and fish. So the function for niacin in our body is to promote healthy skin and tissue, also help in the digestion and in the health of our nervous system. So in case if a person suffers from deficiency of vitamin B3 or niacin, the person will suffer from what is called pellagra. This is an Italian name for rough skin. So that is what pellagra is. And the hypervitaminosis or toxic level for vitamin B3 is not known. Vitamin B4, also known as adenine. The sources for vitamin B4 or adenine are vegetables, fresh fruits, wild honey, whole grain, and cloves. The different functions of adenine to our body are: adenine enables DNA and RNA to store and transmit genetic information. It is a component of ATP, also known as adenosine triphosphate. Adenine is also a component in cell formation, helps in lowering cholesterol levels and production of antibodies. Deficit of adenine can cause Alzheimer's disease, Parkinson's disease, cardiovascular diseases, anxiety, schizophrenia, and ADHD. ADHD, or Attention Deficit Hyperactivity Disorder, can be handled by the simple strategies presented below. Adenine toxicity can also include gastrointestinal disturbances, and that is diarrhea and nausea. Vitamin B5, that is pantothenic acid. The sources for pantothenic acid are kidneys from animals, liver, egg, yolk, yeast, cereals, legumes, and sunflower oil. So, what are the different functions where pantothenic acid serves in the body is that the synthesis of sterols, energy production, synthesis of vitamin A and D, biosynthesis of protein formation of hemoglobin and electron-carrying cytochrome proteins. And another one is that this pantothenic acid also helps in the biosynthesis of acetylcholine. This is our neurotransmitter. So, in other words, if a person is deficient with pantothenic acid or vitamin B5, he or she will experience the symptoms of nausea, stomach cramps, insomnia, fatigue, depression, irritability, restlessness, apathy, hypoglycemia, increased of sensitivity to insulin, numbness and muscle cramps, inability to walk. So, however, there is no record of hypervitaminosis for B5 or pantothenic acid. Vitamin B6 or pyridoxine. Pyridoxine comes from meat, whole grain, vegetables, and nuts. So it is recommended that raw is better, because when the vegetable or the nuts are cooked, 50% of this vitamin B6 will be lost. And so the important function for pyridoxine in the body is mostly metabolic, and that includes amino acid metabolism, gluconeogenesis, neurotransmitter synthesis, creation of histamine, hemoglobin synthesis, and gene expression. And so with that, if a person suffers from the deficiency of vitamin B6, that includes anemia, depression, dermatitis, hypertension, water retention, that's the excess of fluids in the circulatory system or tissue in the body. And it also elevates the level of homocysteine, that's the increase of platelet adhesiveness in our veins, and this is an occurrence of what we call the thrombosis. And for a hypervitaminosis of B6, there will be a sensory neuropathy and may also cause blindness, and also what we call the dermatological lesions. So in the illustration, these are what we call the different types of lesions. Vitamin B7. Vitamin B7, also known as biotin. So the sources for biotin are coming from soybeans, cauliflower, peanuts, and beef liver. The function for biotin in our body is to promote healthy immune system, metabolism, health, and growth of hairs, since there are shampoo commercials that are putting of biotin in their product, and the distribution of color pigment and maintains the nervous system. For the deficiency of biotin in the body, the symptoms are muscular weakness, lack of appetite that will cause anorexia, skin disorder, heart abnormalities, lung infection, anemia, extreme fatigue, confusion, mental depression, including hallucination, drowsiness, and since it's called biotin, it's loss of hair. So for the symptoms of hypervitaminosis for B7, that includes nausea and vomiting. Vitamin B9, also known as folic acid. So folic acid comes from a variety of sources such as milk, green leafy vegetables, spinach, broccoli, cereals, liver, citrus fruits, and whole grain foods. The function of folic acid to our body includes the release of energy from amino acid. It has a role in the manufacturing of new cells and genetic materials, and it works also with vitamin B1, B12, and including iron to form red blood cells. So it is so important that we will not be deficient of vitamin B9 or folic acid. And so if one person or a person is deficient with the folic acid, that includes the symptoms of anemia or the lack of red blood cells, a premature baby at birth, and then also the birth defect that is incomplete closure of the spinal column, such as the one in the illustration. And for the hypervitaminosis B9, there is actually no record or symptoms for hypervitaminosis of B9. Vitamin B12 or Cyanocobalamin. The sources for this are dairy products, cheese, meat, poultry, fish, and eggs. The function for cobalamin in our body is for the normal function of nerves, for the maintenance of enzyme systems, and help in the production of red blood cells along with iron and vitamin B9. The symptoms for a person that is deficient in cobalamin is actually what we call pernicious anemia. This is that our red blood cell or the red blood cell turns into large but cannot function well and can lead to degeneration of the nerves, paralysis, and even death. So, however, hypervitaminosis for vitamin B12 are not known. We will now move to the different fat-soluble vitamins. So, we are also going to discover their sources, their function to our body, the symptoms for the deficit of these fat-soluble vitamins, and their hypervitaminosis. Vitamin A, also known as retinol. The sources for these are liver, cod liver oil, this is a kind of fish, and dairy products, provitamin B-carotene in carrots, red pepper, and tomatoes. The function for retinol in our body is to promote the good vision, protection of skin, teeth, and mucosae. For the deficiency or lack of retinol in the body will cause blindness, infection, and stunted growth of a person, while the hypervitaminosis for A or vitamin A is bone fracture, liver damage, and even some birth defects. Vitamin D, also known as calcitriol. The sources are provitamin in cod liver oil, fish, milk, butter, mushroom, vegetable oil, chicken, pork, sea fish, synthesized through solar radiation in the skin. So it is so important to expose yourself sometimes in the outside environment where you can be showered by the solar radiation for a while. And the function to calcitriol in our body is actually for the bone formation and calcium and phosphorus storage. So how about a person that is lacking or deficit in calcitriol? So they will experience what we call as the rickets syndrome. So this is how the a leg or the bone structure in an x-ray of a person with rickets. However, for a person that has too much of the calcitriol in the body will also experience what we call the calcium imbalance. Vitamin E or tocopherol. The sources for vitamin E or tocopherol comes from seed oil, nuts, butter, margarine, whole grain crops, and sunflower oil. The function for tocopherol in our body is the formation of the red blood cells and tissues. At the same time, it is very high in antioxidant properties. So vitamin E is also a beauty vitamin. So for the deficiency of tocopherol, that includes the symptoms of red blood cell breakage or nerve damage. So it is so important to have a good amount of tocopherol in the body. However, if a person that is suffering also from too much of the tocopherol, too much tocopherol can interfere with the blood clotting drugs. So it is also not good for persons who are taking a blood clotting drug to have too much of vitamin E. And the last for the fat-soluble vitamins is vitamin K. And there are two types of vitamin Ks. We have vitamin K1, which is phyloquinone, vitamin K2, which is also known as menaquinone. Both K1 and K2 serves as the same function and comes from almost the same source. So they are usually coming from green vegetables, and their function is usually for blood clotting or homeostasis and blood coagulation. They also promote bone health. However, persons suffering from deficiency of vitamin K will experience hemorrhage, and too much of it can also have a depletion of the levels of glutathione in the body.